Hello everybody, I am Dr. Vivek Vardhan from Shwasa Hospital, Narayanguda, Hyderabad. So everybody would have heard about this coronavirus, which has caused an epidemic in China, and now it is not an epidemic anymore, it is a pandemic. That means it has involved multiple countries in the world. So I'll tell you in detail about coronavirus and what are the risks or chances of getting it, and what should we do to avoid it, and what to do if we get the virus and how to get tested. So let us start with what is corona. Corona, it is named so because of the shape of the virus. It looks like a crown, so it is called coronavirus. And this is not the first time corona has affected our human race. It has affected our human race multiple times, with the major episodes being in 2002, that is SARS, Severe Acute Respiratory Distress Syndrome, which was again from China, and it has spread to over 30 countries, killing more than 800 people. So it was a very dangerous epidemic and pandemic then. And again in 2012, something called as MERS, M-E-R-S. It has started again from the Middle Eastern countries, and it had spread to again 30 or plus countries, killing 800 more people. So this corona, whenever it spreads, it will kill people rampantly. So now the latest coronavirus is 2019 nCoV, that is 2019 novel coronavirus. It has started from a marketplace which sells seafood and also all kinds of animal foods, including bats, rats, dogs, snakes, as so and so forth. So this is because they eat a lot of foods like this. So it has started from one of those animals. It has not been confirmed which is the actual source, but it is suspected to be either bat or a snake. Okay, so it had spread from an animal to a person who handles that, animal handlers. So from there, it had spread to other people, that is human to human transmission. So the first case was identified on 29th of December, and it was proven to be a coronavirus. It was identified as corona on 7th January, and the first death was recorded on 11th January 2020. And from then till now, till 30th December, till yesterday's data according to World Health Organization, it has killed 170 people, and it had affected more than 7,800 people worldwide. Of that, only around 6,000 are from China, whereas remaining 1,500 people are from other countries such as India is also a part of the infected countries, and also USA, France, multiple countries. Total of 15 to 18 countries are affected already. So you must understand what is the severity of the infection and how rampantly it can spread. So now, coming to what are the sources? I said it is bat and humans are the next. And what are the symptoms that coronavirus shows once it spreads? So it can be as simple as a common cold. It can be cold or cough or throat irritation, sore throat, and it can slowly increase to cough, and later on in few days it may become a severe breathing problem. So once a patient develops severe breathing problem, that means he would be suffering from a coronavirus induced pneumonia, which is a very different type of pneumonia. It has not been seen, never been seen before. So it has a very high mortality rate. That means if it is affected, then chances of death are very high. So one is because of the respiratory failure, that is the lungs will fail, and the second one is because of the kidney failure. It will fail your kidneys. Okay, so now you'll be wondering, who will I get corona? So you'll be wondering, who will get coronavirus? Anybody starting from a child till an adult, till an old age, can get coronavirus, but usually children are slightly immune, or they will have a very mild disease, very little cough, cold, and they'll be okay. But adults more than 40 and especially more than 60 years age are specifically affected the highest. That means if more than 60 age group gets this infection, it is very severe and usually leads to death. And also in pregnant females, this is a severe infection. Along with that, in people with multiple diseases, comorbidities such as renal failure or liver failure and other heart and lung diseases are more prone to get, severe disease. So this is about who and how can they get it, and how does it spread. This is also very important. So like any other virus, you have to remember this point, like any other virus, this spreads through droplet spread. That is, when a person coughs or sneezes without any protection, that is without covering his nose or mouth, so the droplets, that is the tiny particles, will spread till a distance of about 30 meters, 3 to 30 meters, depending on the intensity of his cough or sneeze. So that will spread, that will distribute the virus all over the place. And this will, when a person goes around and breathes those virus particles, he'll simply get infected. So it is very easy to spread, and that is the reason why it has been spreading so much. And one more thing is, if a person who is infected touches his nose or mouth and shakes his hand with a person, so that will cause spread to the other hand, that is the fomite. And this hand, like the other person, when he puts his hand here, or when he inhales, or if he puts on his mouth, the virus will enter inside. So not only shake hand, but also high touch areas such as mobile phones, touch screens, and keyboards, mouse pads, and these doorknobs on all the beds areas, like which are commonly touched areas. So they have the highest amount of viruses lying there, because these people would have touched them. So when a person touches it and puts it here, his nose or mouth, which we usually do, the virus will be transmitted. So this is one of the forms, and droplet spread is one of the forms. And one more thing is, it can spread from animals. That is how it started. And it can also come from a improperly cooked meat, that is meat which is not cooked properly, and you eat it, you don't wash it properly, you don't cook it properly, then you have a chance of getting the infection. So this is how it spreads. Okay, and next we will talk about the treatment of this coronavirus. So is there a treatment of coronavirus? No, there is no specific treatment as of now. So is there any vaccine? It has not been developed yet, because it is relatively a new virus. So there is no treatment, no vaccine. But what can we do now in the hospitals? So what we can do is, we can give symptomatic treatment. That is, we can treat his runny nose, we can treat his cough, we can treat his breathlessness. That is what we can do, that too till a certain extent. If it passes a certain time or certain extent, the disease, it is very hard to treat. We don't know how to handle it yet. Although we can put the patient on ventilator, we can put him on multiple medications, antibiotics, which we don't think they work. And so these are all things we can do. But if it's on the last stage, then it's very hard to save the person. So initial stages, we can just give treatment so that it will probably, hopefully halt the disease, and it will treat the problem probably. So we don't really know what is the treatment. So where did I get this all information from? Where did I get this? So it is from WHO website, and also from few good journals such as NEJM, Lancet, who published their recent papers from China and also other parts of the world. So this is collected from those areas. So this information is authentic. And I'll tell you about coronavirus in India. On 30th January, that is yesterday, first case has been reported in Kerala. She is a girl studying in a university from Wuhan, where this started. So she had come to India, and she's having she had some symptoms, and she was detected positive for coronavirus. So that means there is a threat in India too. So if it's in Kerala, then that means it could be anywhere in Delhi or Hyderabad. People are traveling a lot. They keep coming from China to different places. In Hyderabad also, there were like 4 cases was suspected to have this virus, but they were detected negative in the fever hospital. So not in Hyderabad yet, but if we don't take precautions such as washing your hands properly, so these are the important precautions. You have to wash your hands well, and when you shake your hand, don't put it near your mouth. Just go and just use a sterile, sanitizer or sterilizer, and or a hand wash, or you can just put Namaste like Indian. And one more thing is, you have to wear a mask, or people who are coughing a lot, you suggest them to wear an N95 mask, not just any mask, but N95 mask. Okay, so those masks are available everywhere in the pharmacy. So you can just buy one of those masks. They look like this. Okay, so you put them, you cover your mouth and also nose with this mask. Okay, so this will go behind, so it will just cover entirely. So the person, when he coughs or sneezes, virus will not enter beyond this. So it will not go beyond. So that means it is sealed. right? So it's like you are preventing the spread of the virus. So this is one of the very good masks available. N95 or N99 is also available in the market. So any of these will help. And apart from this, cook your meals properly, the meat especially, which you buy from the markets. So meat should be cooked properly, any kind of meat. And if it's properly cooked and the viruses will die, you can eat that, no problem with that. And when you go to wet marketplaces, just be careful, because those are the places where not just corona but many other viral infections originate. We kill animals, we put them there, all the viruses, high chance of transmission from there. So just be careful about that part. And if you feel a particular object like a doorknob or a railing, which people usually touch in airports and all, is contaminated, you can just sterilize it by using 1 tablespoon of bleaching powder with 1 liter of water. So that can be taken through a sponge, and you can just rub it, so that it will sterilize, it will kill the virus. So this is one of the precautions again. So one more thing, when you travel to other countries also, because it is there all over the place, all over the world. So whenever you travel, just make sure you don't touch anything frequently. You just avoid touching and handshakes, and keep a sterilizer with you so that you can just do this all the time. So these are very important precautions. And if someone is coughing in the flight, just tell them to give a 95 mask, which should be available because of the outbreak. Everyone would be prepared. So these are all the precautions that you are supposed to take. So primary prevention, we call this primary prevention, that is by public education. We tell you what to do and what not to do, so that you have an idea about this virus, you are aware of it, and you will take some precautions such as washing hands and all these that I have told, and you will play a role in decreasing the spread of this virus. And the number of people who are infected, if it is less, automatically the deaths will be less, and the cost to the country will also be less. China, it is causing billions of dollars just because of this virus. They have almost sealed the entire city, if not the entire state. And also they have announced level 1 emergency, that is there is no train connectivity, nothing to that part of the city, and all the hospitals are full with these people. And China is doing a really good job. They have set up a 1,000-bedded hospital in just 7 days. They have built a hospital of 1,000 beds. You can see it on YouTube. They are doing a very good job in handling this virus. If it happens in India, we hope our government also, is prepared for this, and it will handle well, if at all, if it spreads. But before that, it is your job to, prevent the spread of the virus. Just take care, not just of you, but also of the others. Just tell them whenever they cough or sneeze to wear the mask. So I'm repeatedly telling this point because this is the most important thing you can do, or else if it is beyond that, then we take care of it. But the sad part is there is no particular exact treatment. So it is a dangerous virus. So this is just to educate you and caution you, not to scare you. There is no need to panic, but yes, you have to be concerned and you have to be cautious. Okay, thank you very much.